Becca. I just got out of the hospital for the millionth and tenth time, and I decided I wanted to make another video. This video is going to be about my brain tumor and my diabetes insipidus. Back in 2012, I started putting on a lot of weight, and everyone was very confused, and they started off alarm bells going in their head because I've always been very tiny, especially with my gastroparesis. And even before I had gastroparesis, before I was 10 and I got sick, I was still really tiny then. And back in 2012, I went from 81 pounds to 190 pounds. And it was really weird because I was barely eating. And people that didn't really know me were like, oh, well, you know, just lower your carb intake, watch your fats, exercise a little more, you'll be okay. Even doctors were saying that to me that didn't know me well. But the doctors that knew me well and my parents and my close friends were going like, what the heck is happening? This girl barely eats. How is she gaining weight? This makes no sense. And on top of that, I was having really severe headaches, and my blood pressure was going up really high. My blood pressure was going up as high as 190 over 130, and my primary care doctor decided to send me to a kidney doctor, because that's apparently who you go to if your blood pressure is too high. The kidney doctor also told me that my heart rate was really high, and she was very concerned. When she measured my blood pressure, it was 195 over 132. And so she decided to order a lot of tests. She ordered a 24-hour blood pressure monitor, she ordered a lot of blood work, and she ordered a 24-hour urine. For a 24-hour urine, I had to collect all my pee for 24 hours in a big plastic orange jug and then bring it to the lab. A few days after I dropped the orange jugs off at the lab, I got a call from Dr. Becca, the kidney doctor, and she told me that I had the highest urinary cortisol that she had seen in her entire career, and that she was going to order both, and urinary cortisol is cortisol is a stress hormone, and that it's released by the pituitary gland in the brain, it's secreted by the pituitary gland in the brain, and regulated by the adrenal glands, which are on top of the kidneys. So she ordered a MRI of my brain and an ultrasound of my kidneys. The ultrasound of my kidneys came back normal, but the MRI on my pituitary gland of my brain showed a large tumor sitting on top of my pituitary gland. Next thing I know, I was getting an appointment set up with an ultra-specialized neurosurgeon at Mass General in Boston, which was a 2-hour drive from my house in Springfield. And the next month was a flurry of doctor's appointments, pre-tests, procedures, testing, meeting with doctors, going back and forth from Boston to Springfield and back again. And the next thing I knew, a month later, it was 6 a.m. and I was driving up. Oh, that's my pump, sorry. I had to fix my feeding pump. Just a little clamp in the line, kink in the line. Happens sometimes. Should be all set. Anyway, the next thing I knew, it was 6 a.m. on a Wednesday morning, and my mom was driving me up for a 6-hour neurosurgery to get the brain tumor removed from my brain. They said that there was a 20% chance that I would relapse, but an 80% chance that the tumor would be completely gone and I would not need chemotherapy or radiation or anything. I would just be cured. So we were really hopeful, and I was really, really nervous. But when I first got there, they took us into the pre-op room and they talked to us. We had to sign papers. One of the papers we had to sign was that I was going to risk getting a disease called Diabetes Insipidus, which is a disorder where you can't concentrate your urine and you pee out all the fluid in your body. So that was one of the risks of the surgery, so I signed that I might get that. I didn't think much about it. I figured I probably wouldn't get it. It was just a risk I had to sign. I also had to sign that I might not live through the surgery, that I might be permanently paralyzed, that I might have permanent brain damage, that I might have a stroke. All of these horrible things I had to sign that I might have. And then the anesthesiologist came in, and I was like shaking by that time, and my mom was trying to calm me down. And the anesthesiologist gave me a injection in my IV of some medicine to calm me down, and it made me a little woozy and a little dizzy, but I was okay enough to give my mom a hug and tell her I'd see her in the recovery room. And then they wheeled me into the operating room, and they started giving me the medicine that would actually put me to sleep. And that medicine, once that was in, everything started fading out, and I heard voices around me talking, and I started panicking. And I started screaming, I'm awake, don't operate, I'm awake. And then the voices started getting closer, and I started screaming louder, and then they said, wait, it's okay, the surgery's over. You're in the PACU, the surgery's over, it's done, you finished. You did great, the tumor's out, it's gone, you're recovering. Do you want your mom to come in? And I was like, wow, that was easy, it's done. And it was really simple. I stayed in the hospital for 4 days. I was put on steroids, which I'll now have to take for the rest of my life after that surgery. And I was started with intensive physical and occupational therapy to learn how to walk again, to learn how to move right again, because it was a major surgery. And I went home after those 4 days, and things were great for about 3 weeks. After 3 weeks, I was still using the walker. I was still very weak. It took a lot of extra help to get things done. I had in-home nursing for those 3 weeks and in-home health aides, but I was okay. And then one night, I woke up in the middle of the night, and I was gushing blood out of my nose. I woke my mom up, and she helped me. She grabbed me a pink basin. The pink basin looked like this. It's a regular pink basin like they give you in the hospital. It was filled up to the top with blood within a few minutes. Before it had a chance to fill up the second bucket, my mom called 911. By the time the ambulance got there, the second bucket was filled up with blood, and they rushed me to the hospital. At the hospital, the doctor stuffed my nose with gauze and was able to stop the bleeding and pinched it with these wooden sticks that he had. He made this like structure out of wooden sticks, and he used to pinch my nose closed after he stuffed it with gauze. And he told us that I was just a regular kid with a nosebleed. It was nothing to worry about. It was normal. My mom kept insisting to him that I had just had neurosurgery 3 weeks ago, and they'd gone through my nose to take the tumor out piece by piece. And she kept asking me, are you sure it's not the brain surgery? Are you sure this isn't related to the brain surgery? And the ER doctor kept insisting, no, this is not the brain surgery. It's a normal nosebleed. 3 weeks out is too late to have it related to the brain surgery. So he sent us home with extra gauze, and he told us not to worry about anything. The next morning, my mom called the neurosurgeon at Mass General and told him what had happened, and he was livid. He was so furious. He said, of course that was related to the brain surgery. He should never have done that. He should have kept you. He should have called us. You should have been transferred here. And if that happens again, you should go straight back to the local emergency room. Once you're stabilized, you should be immediately transported back to Mass General, and I'll see you there. And he set up an appointment for us the following day to come back and get looked at and get assessed. So he said, if it happens before I get back to Mass General the next day, I should get immediately transferred to Mass General once I've been stabilized at the local hospital. Sure enough, the day before the next appointment, I woke up in the middle of the night. It was about 11:30 at night, and I was gushing blood again. And I filled up another one of these lovely basins with blood. And my mom called 911 again, and we got down to the hospital, and she told them that they had to check me for cerebrospinal fluid. And they checked me for cerebrospinal fluid, and sure enough, I was bleeding out of my brain. And so they stuffed something called a rhino rocket up my nose. It was the most painful thing I've ever had stuffed up my nose. It was like a torture device. It was this round, thick, pointy object, that like stuffed, hard object. And they stuffed it up my nose, and it must have jumped about 2 feet off the bed. And the nurse laughed and said, that's why it's called a rhino rocket, because the patient rockets off the bed when you stuff it up their nose. But it did stop the bleeding, and they immediately called Life Flight and had me transferred by helicopter to Mass General. And my mom couldn't come with us in the helicopter. She had to drive down, and I was so scared. I didn't want my mom to drive down without me. I wanted her to come in the helicopter with me, but they said that she couldn't come in the helicopter with me. She had to drive down separately. We were almost there when I started bleeding out the other side of my nose. By the time we got to Mass General, they were trying to stuff a second rhino rocket up the other side of my nose, and then I was bleeding out my mouth too. And I was squirming around, and I was really uncomfortable. I was in a lot of pain. And one of the doctors looked at me and said, stop squirming around. If you don't let us put this rhino rocket up your nose within the next few minutes, you're going to bleed out and die. So I stopped squirming around immediately, and I let them put the rhino rocket up my nose, and it hurt like crazy. And then they said that they were going to take me into surgery. They were going to start a blood transfusion, and they were going to take me into surgery, and my mom would be there when I woke up, and hopefully everything would be okay. And they had me sign emergency surgery paperwork, and it was really scary. And I was so uncomfortable. I was so relieved when they told me they were going to give me the anesthesia, because then at least I would be out of pain. Because I've had pain before, but this was the only time I had genuine 10 out of 10 pain. This was the worst pain I've ever had in my life. This was serious pain. I was the most uncomfortable I've ever been. And I got the anesthesia and I went to sleep. And when I woke up, besides feeling relieved, the most intense feeling I had, besides being relieved that the surgery was over, relieved that most of the pain was gone, relieved that my mom was there with me while I was wrapped in blankets and on high amounts of oxygen and shivering, was that I was thirsty. I was so thirsty. I was desperately thirsty. If you think you've been thirsty, you've never been this thirsty. I was so thirsty. I drank about 10 cups of water before they cut me off the water and switched me to popsicles and ice chips. And then I was guzzling the popsicles and ice chips like crazy. And then I started peeing like crazy. And then they knew that I had diabetes insipidus from the second brain surgery and from the first brain surgery. Both the combination of the two brain surgeries had caused diabetes insipidus. So I didn't have that antidiuretic hormone. My brain stopped producing antidiuretic hormone. So all my pee was coming out. All my fluid in my body was getting peed out. My pee looked like water. It was clear like water. I couldn't hold on to any urine, and my sodium was going up so high because I was so completely dehydrated that my sodium was sky high, and I was completely and totally dehydrated. And from then on, I got placed on a medication called desmopressin. Most people that take desmopressin can take desmopressin by pills or by nose spray, and that's how they take it. But because my diabetes insipidus is so severe from both brain surgeries, I take it by injection. This is the desmopressin that I take. The way I take it is in shot form. I already took it tonight, but I'll just show you how I draw it up, and then I'll squirt it back in the bottle. I take the bottle. I swab the top with alcohol. Then I draw back the dose with air. I inject with air the amount that I need to draw back. I take 0.6 micrograms. And then I pull back on this syringe until I get the right dose. And then I'm not going to actually inject it because I already injected it tonight. But I pinch myself and I inject it into my skin. I'm going to put it back in here now because I already took it tonight. That's how I give myself my desmopressin. I have to take that twice a day, every day, for the rest of my life. A lot of people that get diabetes insipidus from surgery, after the initial brain trauma, they're able to stop taking it like a few months later. But because I've had to take it after a few months, my diabetes insipidus is now permanent, and I'll have to remain on the medication for the rest of my life. Now, most people that have the surgery are cured after the surgery. Unfortunately, after my surgery in 2012, back in May, I started having severe headaches, a 30-pound weight gain, and seizures, and high blood pressure again, and rapid heart rate. I called my neurosurgeon, and I knew before he even got the results of the 24-hour urine and the results of the MRI that I had my tumor back again in May of this year. Because I have my small fiber being so advanced, I can't have another surgery to remove the tumor again. Instead, I've completed a course of radiation therapy. I had a 6-week course of radiation. This is the mask that they put on me for radiation. It goes over my face, like this, and then the mask got pinned down to the table with these pins, and then these little X's on the side marked where the radiation goes, so it directly goes to the part of my brain where the tumor is. And that's how I got my radiation. I got 6 weeks of radiation, and I'm also getting chemo right now. I'm still getting the chemo, and I'm going to be getting it for a while because it's a particularly tough tumor to treat, this one. But you can knock me down, but you can't knock me out. I'm going to get through this. I know I will. I have my boyfriend supporting me. This is my boyfriend, Jeff. He's supporting me through everything. He's amazing. He's been the camera guy behind the camera. He's the most amazing, supportive boyfriend I could ever ask for. And together we're going to make it through this. Thank you for watching. Have a good night. Bye.